Hello and welcome. Today we're diving deep into a condition that affects millions worldwide, a condition often shrouded in mystery and misunderstanding, bladder pain syndrome or BPS. This is more than just a frequent urge to go, it's a chronic, often debilitating pain that can significantly impact quality of life. Pinpointing the exact cause of bladder pain syndrome remains one of its biggest challenges. There's no single smoking gun. Instead, it's thought to be a complex interplay of factors. These can include damage to the bladder lining, perhaps from inflammation or injury, or even abnormalities in the nerves that carry signals to and from the bladder. Some theories propose an autoimmune component, where the body mistakenly attacks its own bladder tissue. Still, other research suggests a role for mast cell activation, releasing inflammatory chemicals within the bladder. Essentially, the etiology is multifactorial, varying perhaps person to person. Let's explore the proposed mechanisms of bladder pain syndrome. Normally, the bladder lining protects the underlying tissues from the irritating effects of urine. In BPS, this protective barrier may be compromised, leading to increased permeability. This allows substances in urine to irritate the bladder wall, triggering pain, inflammation, and a heightened sensitivity. The nerves in the bladder, already potentially hypersensitive, react even more strongly to stimuli that wouldn't normally cause pain. This heightened sensitivity, coupled with ongoing inflammation, creates a vicious cycle of pain and urgency. Bladder pain syndrome is more common than many realize. While accurate prevalence is hard to nail down, estimates suggest that millions of adults, primarily women, experience BPS symptoms. Studies indicate that women are far more likely to be diagnosed with BPS than men, although men can certainly be affected. The condition can affect people of all ages, but it's most commonly diagnosed in middle adulthood. The underdiagnosis and misdiagnosis rates for BPS are unfortunately high, making it difficult to get an exact picture of its prevalence. The hallmark symptom of bladder pain syndrome is, of course, bladder pain, but it's not always a sharp, stabbing pain. It can manifest as a burning, itching, or pressure-like sensation in the bladder or pelvic area. Many people also experience urinary urgency, the feeling that you need to urinate immediately, even when the bladder isn't full. Frequency, needing to urinate many times throughout the day and night, is another common symptom. Pain can worsen with bladder filling and be temporarily relieved with urination. For some, pain may also radiate to the urethra, vagina, or rectum. Sexual intercourse can also be painful. The symptom severity varies from person to person and can fluctuate over time. Diagnosing bladder pain syndrome is often a process of elimination. There's no single test that definitively confirms BPS. Doctors typically start with a thorough medical history and physical exam. Urine cultures are performed to rule out urinary tract infections. A cystoscopy, where a small camera is inserted into the bladder, may be done to visualize the bladder lining and rule out other conditions. Biopsies of the bladder wall may also be taken during cystoscopy. Doctors also often use questionnaires and bladder diaries to track symptoms and voiding patterns. Diagnosis can sometimes be challenging, and it's important to see a doctor experienced in pelvic pain conditions. While all bladder pain syndrome shares core features, there are subtypes. Interstitial cystitis, or IC, is often used interchangeably with BPS, though some differentiate them. IC typically refers to BPS when visible inflammation or lesions, known as Hunner's ulcers, are present in the bladder during cystoscopy. However, most patients with BPS don't have Hunner's ulcers. Therefore, BPS is a broader term encompassing various presentations of chronic bladder pain. Non-ulcerative IC is a term used to describe BPS without Hunner's lesions. In the end, the important is that any treatment plan be tailored to your specific symptoms and presentation. Unfortunately, there's no cure for bladder pain syndrome. Treatment focuses on managing symptoms and improving quality of life. A multifaceted approach is often necessary. This might involve dietary changes, avoiding foods and drinks that irritate the bladder, such as caffeine, alcohol, and acidic foods. Bladder training techniques can help reduce frequency and urgency. Medications such as pain relievers, antihistamines, and tricyclic antidepressants can help alleviate pain and inflammation. Bladder installations, where medications are directly infused into the bladder, are another option. Physical therapy can help strengthen pelvic floor muscles and reduce pain. In rare cases, surgery may be considered as a last resort. Because the exact causes of bladder pain syndrome are unclear, definitive prevention is difficult. However, there are steps that can be taken to promote bladder health and potentially reduce the risk or severity of symptoms. These include staying hydrated, avoiding known bladder irritants, practicing good pelvic floor hygiene, and managing stress. Early diagnosis and intervention can also help prevent the condition from worsening and improve long-term outcomes. The prognosis for bladder pain syndrome varies. For some, symptoms may be mild and manageable with lifestyle changes and medication. For others, BPS can be a chronic and debilitating condition that significantly impacts their lives. Research is ongoing to better understand the causes of BPS and to develop more effective treatments. Recent advances include studies exploring the role of the gut microbiome in bladder health, as well as the development of new medications and therapies targeting specific pain pathways. It's important to stay informed and work closely with your healthcare team to develop a personalized treatment plan that meets your individual needs.